Hello, everyone, and good evening once again. This is Dr. J at Ask the Gynecologist, and tonight is a wonderful one. It's the first day of the week. I know I've been missing online for the last few days. It's a busy weekend. It's the festive weekend, so trying to get things sorted for the family for Christmas, putting up family decorations and Christmas tree and lights outside. So it's been busy. So apologies for that. And once again, my name is Dr. Lalade at Ask Gynecologist, and tonight I'll be talking about scans and bleeding in early pregnancy, So I want you to listen attentively because I'll be taking this topic quickly because of time. I know it's late at night, people are already going to bed, so I don't want to spend too much time so I don't disturb people's sleep time. But be that as it may, I still want to talk about these things because I'm passionate about it, and it's very, very important we understand this. So, if you're getting ready for Christmas, my prayer is that Christmas is going to be wonderful, rewarding, and enjoy and wonderful, blissful for you, for your family, for your home, and things shall work out well as planned. My prayer, my desire for you is that as we move into this new year, coming 2022, this new year shall bring blessings and grace and health, peace, prosperity to each and every one of us listening to me today. If your desire is for pregnancy, my prayer is that God Almighty would not disappoint you, because God never disappoints, and you key into your own destiny and you carry your own baby with your own hands and you dance a beautiful dance of joy. That is my prayer for you if you're listening to me tonight. And I can see people are already coming up online. Ruth Abosede Okundiju, my wonderful friend. How are you? How is your sister? Ellen Busayo. Inche Chukwube, Emily Cheesy. We have my sister Azomta SB Ito, Chinomso, Ellen Busayo, Fabulous New York on Instagram, Tracy Davids, Abigail Ayomide, and Precious 62, and many, many wonderful people. And also my sister is here, Veronica Ajayi. Thank you, Ajoke. God bless you. And Florence Ame, congratulations and on your delivery of your new bouncing beautiful baby. Congratulations to you. So tonight, what really prompted me to talk about this particular topic today is the things I discuss here consistently are the things I see every day at work. Every day, antenatal, you see people that are pregnant, and I use examples of the things I see to make clear, because what happens to people here is also what happens to people back home. Is the same human body, and there's no new model of any human body. We are all the same. If you cut me, you cut someone that's in Australia, we will bleed red blood. Yes, our blood may have different blood groups, but it's still blood is blood. If you cross match the blood together, you get the right type, you can transfuse blood. So blood is blood is life. So we are all human beings, we are all the same. What makes us different, despite our color, is our experiences and our exposure and our limitations as well. So what I want to say is that the things we see here are typical of the things that happen back home. After all, we're reading the same medical textbook. The human body is the same. I saw a lady today, she's 29 weeks plus 3 days. She had intercourse and she bled over the weekend. She came today because she was rhesus negative. She wanted anti-D injection. Another thing I want to mention is about anti-D injection. You'll have heard us talk about rhesus incompatibility among spouses, that if you have rhesus negative blood and your husband is rhesus positive, at pregnancy and at delivery, you will need anti-D injection to prevent you producing antibodies that might harm future pregnancies. So anyway, this lady came to the assessment unit today. She had intercourse over the weekend. She bled, 29 weeks pregnant. We took her blood, Kleihauer test. We call it Kleihauer test, to give her anti-D, to know what dose of anti-D injections you require. So she was asking me, oh, doctor, what could have gone wrong? So I told her, it's difficult to say. You might bleed for so many reasons in pregnancy, and these are the things I'll be sharing tonight. So I explained to her, you might bleed for so many reasons. So I said, we need to examine you, do a scan to check that everything is fine. So on our 20-week scan, this lady, the placenta is not low. One of the major causes of bleeding in pregnancy is low placenta. Anita Juma, I'll talk about subcorionic hematoma. Hold on. So I explained to her that one of the commonest causes of bleeding in pregnancy is low placenta. And that will usually happen as we enter into the second trimester. But for today's discussion, I'm going to take bleeding in each trimester. Each trimester is because the pregnancy period of any woman is divided into 3. 0 to 14, that's the first trimester, or 13. Then the second trimester up until about 24, 25 weeks. Then the third trimester till the end until delivery. So this woman came, I examined her. The cervix was okay. The cervix is the neck of the womb, the way you see at the top of the vagina when you examine a patient. So the cervix was okay, no bleeding from the cervix. But what I could see on her cervix was a cervical polyp. A cervical polyp. And that thing looks like a tiny, when you see those skin tags on people's skin, that's what it looks like. Okay? Now, a cervical polyp is not a skin tag, but I'm only using description of a skin tag to make sure, or to kind of make you understand what it looks like. It's not cancer. It's just one of those things you see. So this lady had this cervical polyp on the cervix, and you could see the cervical polyp. It was dark blue. Apparently, she bled from it. Maybe during sex, the gas of the sex, she bled from it. And I spoke to her. That's where you bled from. But we've taken swabs just to check for infection. Another reason why you might have a bleeding in pregnancy is from infection, commonly from thrush infection, yeast infection. So it doesn't look as if she has thrush. There's no unusual vaginal discharge, but I took vaginal swabs anyway, just in case there was an infection there, which I sent off to the laboratory. So, but I told her we can't remove the cervical polyp in pregnancy. You probably bleed more. Another reason why people bleed in pregnancy in the second trimester is if they've had any problems with their cervical smear. Cervical smear, every woman in a reproductive period must have cervical smear every 33 years. If you are under 55, you should be having regular cervical, if you're under 59, you should be having regular cervical smear every 33 years to check for any cancer signs on your cervix. If you do not have a regular cervical smear test, you could develop things that can make you bleed in pregnancy. So I also asked this woman whether she has any complications or any issues with her cervical smear test or pap smear, depending on where you are. Cervical smear and pap smear are the same thing. So I asked her, have you ever had any problem with your cervical smear? She said no, and her cervix looks fine. Okay, so that was it. So I scanned her. Placenta was okay. Placenta was far away. It's not low. Baby was moving well. Baby's okay. The blood flow in the cord was good, normal. Baby's heartbeat was fine. I reassured her, sent her home. She had the anti-D injection. Another reason why you could bleed in pregnancy, especially in the second and third trimester, is from low placenta. That is why it's essential that you check your placenta, especially when you're 20 weeks before you move into your second trimester. The placenta is very big, and in first 12 weeks of pregnancy, the placenta is actually bigger than a baby. Yes. And the chorion is what becomes the placenta, essentially. Some people in their first trimester, they have what we call subcorionic hematoma. A close family friend of mine had a subcorionic hematoma in our first trimester. In fact, on our 11-week scan. So what that means is this. Let me see if I can draw it on my whiteboard. Can everybody see my whiteboard? Let me take off my my financial lecture stuff here. Now let's bring this board here. So on Instagram, you might not see my face, but I want you to see the board. So on YouTube as well, you might not see my face. I want you to see the whiteboard. People who are watching me right here on Facebook will see the board more clearly. Now, what I want to do. Now, this is the womb in pregnancy. okay? And that's the cervix. The cervix is the neck of the womb, okay? In early pregnancy or in the first 12 weeks of pregnancy, the placenta, okay, is what we call a chorion, okay? It covers much of the womb, okay? Some people could bleed, tiny bleed collection below the placenta there, okay? That's what we call subcorionic hematoma. And that blood is usually organized, and that could be a sign or increased risk of miscarriage. Sometimes the bleeding will continue and get bigger and bigger and bigger and bigger and bigger and extend all the way and tend to push away the placenta from the attachment to the wall of the womb, and it can cause miscarriage. For some people, most people, the subcorionic hematoma will stop and the pregnancy will progress normally and they'll be okay. Subcorionic hematoma can happen, yes, from trauma, maybe domestic violence. Somebody hit your tummy, you fell down. It can happen. Sex doesn't cause it, or maybe yes, I don't know. I don't think sex causes subcorionic hematoma. And in some cases, we don't even know what causes it. It just happens on its own and it resolves, okay, on its own. It's not what you've done wrong or what you've done right that made it happen. It's just one of those things that happen. Some people, the bleeding becomes bigger and they can lose the baby and the placenta can detach. Now, how can you stop it? We don't stop it. Okay, it's either it's there or it's not there. If it's there, in most cases, it will stop on its own. Okay, that is where God comes in. Okay, in some people, we give them cyclogest to see if it will help, but sometimes it doesn't help. But we still give cyclogest pessary progesterone, which sometimes help with placenta implantation and reduce the occurrence of subcorionic hematoma. In fact, this is one of the reasons why IVF pregnancy can fail too. Subcorionic hematoma can make IVF pregnancies fail. That's why once you get pregnant doing IVF, we give you cyclogest or progesterone or with pessaries to reduce the risk of you having subcorionic hematoma, losing the baby. So I think I've already answered the question for that lady that asked us on Facebook. Now, remember I spoke about this tiny polyp here, okay, on the cervix that woman was bleeding from today. Now, you can see this, so I'm going to rub off this subcorionic hematoma example. Let me continue my explanation here. So now, in most cases, in early pregnancy, the placenta covers most of the surface of the womb inside. So that's placenta. But as the womb gets bigger, let me come back here on Facebook. As the womb gets bigger, okay, so the womb gets bigger, it gets pulled up here, okay? It's getting bigger in pregnancy. This placenta moves up. You see, it moves up. So placenta attachment becomes this place all the way around here. So the new placenta will move here. Okay, so as the pregnancy gets bigger, the placenta keeps moving up and up. That is why if you go for a scan in your first few weeks of pregnancy, maybe at 16 weeks pregnancy scan, they will tell you the placenta is low. But by the time you scan the person after around 32 weeks, in most cases, 80% placenta will have moved away and there are no more low placenta or placenta previa. Essentially, 80% of low placenta in early pregnancy will become normal. As the womb gets bigger, it pulls the placenta away and it goes into normal position. This is very common. So when you hear or you've been scared or you've been totally put into disharmony because they told you on your 16-week scan that your placenta is low, placenta previa, they say don't have sex, don't panic. It's very common. In most cases, 80% or more of those placentas that was low or placenta previa will become normal placenta by the time you get to 20, 30, 32 weeks. In fact, 32 weeks is already okay because at that point, the womb would have grown bigger and will have pulled the placenta up and it's no more low. But in few cases, about 5% of those who have placenta previa, their placenta will still be low all through pregnancy. For those ones, we tell them don't have sex because sex could make or aggravate bleeding in them. We say if you bleed, come to hospital immediately because the placenta is not moving. I saw a lady last week as well. She was about 34, 36 weeks pregnancy, if I can remember rightly, and her placenta was covering the exit. So once the placenta covers the os, this is the os where baby comes out from into the world on during normal vaginal delivery. So this lady, her placenta was covering the whole exit. I tell people all the time, you can put your TV anywhere in the house, but you don't put your TV where the door is. You don't block your door with TV, okay? Because the door must be free. The door is like the cervix, the exit of the womb, or for baby to come out into the world. So if you put placenta here, it will block the exit. So that's what happened for that woman. For such cases, we have to do a cesarean section. No joke about it. And even during the section, it must be done by someone that has got good experience to reduce the risk of severe bleeding that can lead to hysterectomy, losing the womb. In such cases too, we have to cross-match blood, at least 4 units of blood ready in the hospital, in the theater, in case the woman starts to bleed like rain. It can happen, okay? So we need to prepare before we go to theater. What can make a woman bleed in pregnancy? Some people do have what we call placenta abruption, where the placenta, okay, in the second or third trimester, okay, will start to bleed. A woman spoke to me on chat over this morning, actually. She had uterine rupture, okay, at I think 32 weeks. I was surprised, and she told me she had no contraction at all. It just happened. Please hold on Facebook, hold your questions for now. Let me finish this discussion. I will take questions. Just hold on. I'm surprised that people are awake. I thought people won't be awake. I was just sticking and out. But I'm happy you're awake. You're listening to me. I'm so happy. And thank you so much for being awake, for spending your time to listen to me. So this woman, so I asked her, you've never had a C-section before. So what happened? And in fact, it's your first pregnancy. She said she had a fibroid removal about 5 years ago, so if I remember rightly, and that was it. She had only fibroid surgery. And during the fibroid surgery, maybe the way they cut the womb open, there's a way you cut the womb open, doing operation on the womb, like removing fibroid, that will increase the risk of the womb to rupture. So probably how they remove the fibroid, I know in Nigeria, people don't carry operation notes. Whatever the surgeon had done for her, then probably it won't find out there is the details into a current doctor. In fact, even if you tell the doctor that I've had fibroid surgery, the doctor will not know what operation was done, because you can do fibroid surgery in different ways. So depending on where the fibroid is, will dictate how we do the fibroid surgery. Because someone had fibroid surgery, your friend had fibroid surgery, doesn't mean you have the same type of surgery. Because Linkechi had the type of fibroid surgery, doesn't mean that Ada will have the same type of fibroid surgery. It's different depending on the location of the fibroid, accessibility, and experience as well of the surgeon. So that woman probably, she had a cut on her womb like this. If you cut the womb open like this instead of like this, it can increase the risk of rupture. So during pregnancy, the womb can tear apart, it can rupture apart. So this lady was only about in her early third trimester, no labor at all. I don't know what she told me, I'm saying, and her womb ruptured. She lost the baby. She was even lucky to save her life. Uterine rupture is a risk if you've had previous fibroid surgery. That's why I tell people all the time, if you've had fibroid surgery, especially in Nigeria, just assume it's a cesarean section, because it already increases the risk of your womb rupturing. And if the womb ruptures before labor starts, or if the womb ruptures at all, okay, it carries increased risk of the baby dying, because it will affect the placenta blood supply. And in fact, if the woman is saved, she should thank her God as stars. In most cases, that woman will lose that womb, except she was detected on time and she had opportunity to be around erudite surgeons that know their onions in and out. And they are very vast in approaching and dealing with a uterus that is bleeding, that has ruptured, that is totally wrecked. It's not easy to put it back together. That is why, if you've ever had a previous uterine surgery, whether fibroid surgery or anyhow, if you've ever had a previous section, and if you've had a previous fibroid surgery and a cesarean section on top of it. That is the icing on the cake. Just ensure that if you're pregnant, you are being looked after by and also delivered, and you have access to a proper surgeon that knows their onions in terms of dealing with and operating on a pregnant uterus. Pregnant uterus is different from a non-pregnant uterus. They are totally different things. And for you to do a cesarean section on a woman that is in labor is different from doing a cesarean section on a woman that is not in labor. They are two different things. In fact, doing a C-section for a woman that is in labor is different from doing a C-section for a woman that is already in labor that is in full dilatation. We call it full dilatation cesarean section. It's one of the most riskiest cesarean section a doctor can do. Usually it's complicated, and they usually bleed. They have lateral tears, extensive tears. So cesarean section is not just cesarean section. When you get into the game, you will know that they are totally different things. Different things. Omar Rejoice TV, how are you? And good evening to you on YouTube. Now, what can also cause bleeding in pregnancy? Now, if you are rhesus negative and your husband is rhesus positive, if you've had DNC, okay, you should have had anti-D injection. DNC for pregnancy, I mean, you should have anti-D injection. If you're pregnant, if you bleed at any time during your pregnancy, go and get blood test done for Clear-Hour. We call it Clear-Hour test, and you should get anti-D injection within 72 hours. If at all, just for safety, okay? Because if you don't get the anti-D injection, you will produce antibodies that can affect your future pregnancy. If you're rhesus negative and you have a rhesus positive husband, it's not a disease. You just need to be careful. Once you deliver for that man, get anti-D injection within 72 hours. We'll cover that in a separate topic anyway. Rhesus injection. Cover that. We've talked about it over and over here on Facebook here. This is our group. But we'll take care of it later in another discussion. Maybe tomorrow. Stay tuned. This month, 27th, after Boxing Day, I think it's a Monday, is our discussion on Super Sex Masterclass. If you've not yet registered for that masterclass, go and register. It is free, by the way. You don't have to pay a dime to be in that masterclass group, but you must join the group to be able to attend. If you don't attend it, it's up to you, but it's free of charge to anybody from anywhere in the world. Now, let's take some questions, obviously, because people are already itching to ask questions already. Can placenta previa repeat itself in future pregnancy to head or indidi? Yes. If you've had a previous placenta previa, previous diabetes in pregnancy, previous cesarean section, previous stillbirth, you are at risk of having that same thing again in future pregnancies. History repeats itself, usually in different ways. If you've had the previous cesarean section, you increase your risk of having placenta previa, placenta abruption. Yes, in future pregnancy. You increase the risk of uterine rupture if you go into labor. That is why if you had a previous cesarean section, you can try normal delivery, but you should be looked after carefully. If you've had two previous cesarean sections, just do cesarean section. If you've had a previous cesarean section and one fibroid surgery on top of it, either way, depending on which order, it doesn't matter. Just assume you've had a 2 C-section, and the next delivery should be done by cesarean section. If you have yeast infection and bleed in early pregnancy, will it affect the baby? No. As far as it's yeast infection and it's been diagnosed as yeast infection, it does not disturb the baby. Doctor, my monthly cycle is always 24 days and 25 days cycle. When exactly can I go for progesterone test? You can go for progesterone test, okay, on your day 21, counting day 1 from the first day of bleeding. Because you think you have a 24 and 25 day cycle, you can do the progesterone test 2 days. Do it the 21, okay? That's it. So if you see bleeding, okay, bam, day 1 start, count. When you get the 21, do the progesterone test. That's the answer for you, my sister Chinyere. What causes bleeding in early pregnancy? That's what we've been saying here. It could be subcorionic hematoma, it could be miscarriage, it could be infection, it could be from sex, it could be from yeast infection or any other infection. Doctor, when do I start feeling baby kick at your 21 weeks? If you're 21 weeks, you should be feeling baby kicks by now. If you haven't felt baby kicks and you're 21 weeks, tomorrow morning, or if possible tonight, go and get a scan done to check baby. By 21 weeks, you should be feeling baby. In fact, if you've had a pregnancy before, you should feel baby movement from 18 weeks onwards because you're experienced. But if it's your first pregnancy, usually from 20 weeks, you feel baby move, okay? If you haven't felt baby movements by now, you should go and get a scan tonight, yesterday, tomorrow morning, and check the baby. Doctor, what happened when a pregnant woman in her first trimester experienced bitter throat? I don't know what that means, but if you got sore throat, get examined and get treated if you have an infection causing sore throat. Can labor CS be done alongside with fibroid CS? I will not advise my enemy to remove fibroid during cesarean section because you probably bleed a lot. Save yourself your life. Save your life first. Deliver baby. In most cases, the fibroid will shrink after the baby is out. I've seen doctors, I've heard them, they've removed fibroid during cesarean section, but I will not advise any doctor to do it. It's too much of hassle. It's too much of danger. But if you're skilled enough, it's up to you. But I won't advise anybody to do that. Doctor, can rhesus negative cause delay in conception? No. Rhesus incompatibility will not stop you from getting pregnant. No, it won't. You had bleeding at 6 months of pregnancy with twins, and your cervix was open, baby was coming out with cord. You had maybe 2 C-section. Will it repeat itself? It can. It may not. But if you've had such problems before, in your next pregnancy, I'll start scanning your cervix to see if there's weakness in your cervix from 12 weeks onwards, just to know in case we have to put a sac clutch to keep your cervix under control. Okay? Doctor, what is making you want to spot after seeing a period in the middle of ovulation? Possibly infection. Very possible. You're having constant weakness at 31 weeks. Is it normal? Probably you're overstressing yourself. Maybe you have low level of iron. Probably you're standing too long, you're stressing yourself, or you have low level of iron, or you are dehydrated. Sheena Johnson Adoke, good evening. Can ovarian cyst surgery affect vaginal birth? No, very unlikely. Doctor, you've done ovarian cyst surgery. I can't see that. What pill can help me get pregnant fast? I don't know. 5 things must happen for you to get pregnant. You must have womb and ovary. Check scan for that. You must have good sperm from husband or from donor. I don't know how you get it. Number 3, you must have regular sex. Okay. Number 4, you don't have blocked tubes. Number 5, you are ovulating. Once all those 5 things are there, I don't know what other pill you want to take to get pregnant. But if you're not getting pregnant, then we need to know why or what is wrong among those 5 things. And once we put them together, we know what is wrong, we can fix you, and then you get pregnant. Okay? If I tell people here, go and buy this particular water, Dr. J water, you drink it, you get pregnant, people will buy it. I'll be a billionaire today because people want to just do something that will give them magic. I'm not a magician, I'm a scientist. I tell you the truth, what you should do that can make things work for you. There's no magic pill that will get you pregnant if you're not having sex. There's no magic pill that will get you pregnant if your tubes are blocked. There's no magic pill that will get you pregnant if you're not ovulating. There's no magic pill that will get you pregnant if there's no womb or ovary there. There's no magic pill that will get you pregnant if you don't do what you're supposed to do. I've spoken to people here on platinum service, on gold service, on diamond service, and they don't want to do tests to know what their problem is. And still yet, they keep crying that I'm not able to get pregnant, them, for 9 years. But do simple tests, they will not do. There's a lady I'm speaking to now, 3 weeks she joined the premium services. I asked her to do tests. She's dodging like this. Do hormonal profile, she'll bring for me full blood count. What am I going to do with full blood count to get you pregnant? Full blood count will only tell you your level of blood. But she thinks that because her blood is low, that's why she's not getting pregnant. I'm like, no. If you're getting pregnant, you C class get pregnant and you have low blood count. So your full blood count is not to get you pregnant. Do hormonal profile, do HSG, do this basic test or semen analysis. Let's know what is going on. For 7 years, you're not getting pregnant and you are still arguing about full blood count. My sister, my Russia, they call it Russia on Instagram. Go and change your soap. Change this soap thing. Change your idea. Change the mentality. Russia is not working. Stop it. Follow the doctor. I'm the doctor. I tell you to do tests. You say they want to do. What am I supposed to do? I'm a magician. I won't give you one pill to just make things change all of a sudden. I'm a doctor. I've never done magic before. I just tell people basic things to do. If you do them, you're going to see this. If you don't do them, you'll see this. So please, let us be guided, okay? Doctor, help me get pregnant. I can't meet my husband because I bleed. So if you are bleeding irregularly, we should do your hormonal profile. We should do hysteroscopy. We should do ultrasound scan to check what's going on in your womb and causing you to be bleeding irregularly. Okay? Can someone conceive with early 13.7 prolactin? Oh, it's gone. Can't see that. I was trying to read that result, but it's gone. How can someone know the pelvic is safe and wide enough for labor until you go into labor? There have been so many tests done in the past. They do x-rays to see if the pelvis is wide enough to allow baby to come. Let me tell you something. God will not give you pregnancy you can't deliver. Except nature is stupid. And nature is not stupid. And nature is under the power of God. There's no way God will give you pregnancy that you can't deliver. There's no way nature will give you pregnancy that you can't deliver. If you're a woman, I've seen women that are leper and they can born. I've seen women that are horrible and they have big pelvis and they can't born. There are so many factors about getting pregnant and delivering a baby. It's not about checking the pelvis. In the past, they've done many things. MRI, CT scan, X-ray to check what we call pelvimetry, to check if the pelvis is wide enough. And there's been no conclusion. So we've stopped doing that to assess pelvis. It's a waste of time. In the past, it was being done, but at the end of the day, it's a pure waste of energy, resources, and time. You cannot assess in any way to know if a woman can deliver vaginally until she tries to deliver. That's the only way you can assess, predict if a woman is able to deliver vaginally. Annabella's place, hello, welcome to ATG. I see you. I respect you, my sister. Thank you so much. Sheila Phillips is saying that, can a woman get pregnant with bulky uterus? Yes, you can. Can infection cause miscarriage? It can. It can. Infection can cause miscarriage. Yes, it can. Okay. Doctor, we are also on YouTube live as well. We are talking live on YouTube as well. We are also live on Instagram. We've been doing that for the last 6 months. Our YouTube channel is super active now. You can subscribe on our YouTube channel and you can watch all our videos in sequence and you don't miss anything. Also, we are also on Instagram and we are also live here on Facebook. If you don't know, ATG already has a laboratory in Nigeria. It started August 2020 and we are on. And we also have a new IVF center already on Lagos mainland. We opened that in June 2021. And this new year coming, by the grace of God, we are opening another IVF center on another part of Lagos. And we are coming to Abuja soon without delay by the grace of God. ATG is not stopping by God's grace. It's a vision and it's a mandate that God has stamped, and it will live on beyond us by the grace of God. That I have no iota of doubt. Many people thought HCG would be gone at some point 18 months ago, but God proved them wrong because God is here. Where 2 or 3 are gathered together, God is there. God is in HCG. If you don't believe it, then you are not here. If you don't believe it, then you are missing God. God is here because the things we say here, they are backed by science and even my religion too. So that I have no doubt about. And I'm fully convinced and I'm fully reassured and I fully know that God will do things here. I think we got questions here on Instagram. There's a lady called Abi Tope. My period has been changing for 4 months now. I lost count. Is it normal? How do you talk about appointment in the US? Unfortunately, I cannot examine you physically in America. But what you can do for me, my sister Tope, is you can do some investigations and send me the result. I'll need ultrasound scan from you. I'll need possibly hysteroscopy, yes, to look at what is happening in your womb. If you are around Lagos at any time, you can come to our ATG office. We can do scan for you, hysteroscopy. We can do all infertility investigations at the ATG center, including hysteroscopy to look into your womb cavity. The only thing we can't do now is we can't do X-ray. We don't have X-ray space. Our space is a problem. If we had a space at the ATG office in Alimosho, we'll put X-ray machine there. We can do HSG. So that's the only thing we can do. And at our new location on the island, which we are opening soon, we will be able to do X-rays and HSG there by God's grace. So we are getting ready. We are working tirelessly to ensure that comes to fruition by God's grace, and I have no doubt. When donating your eggs, can it cause antibody sperm on woman? Blah blah blah. I don't know about it. I don't think so. My sister travel. I don't think so. No. So ATT laboratory is already on the mainland. Ali Mosho. You can do all your infertility tests there. And once you do your test, okay, at the ATT laboratories, we can always review your results for you free of charge. Thank you. So, doctor, is hysteroscopy done? Your doctor said everything is okay. Does that mean that you can get pregnant easily? Well, if you've done hysteroscopy, that's fine. But many things come into play before you can get pregnant. Okay? Like I said again, 5 things must happen for you to get pregnant. You must be ovulating, your tubes must not be blocked, the sperm count must be good, you should be having regular sex, and also you should have a womb and ovary. Okay? So all these things must come into play before pregnancy can happen. Just because your hysteroscopy is okay does not mean you've ticked all those boxes. No. So let us try and understand this and put it in. See, this is not magic. This is science. Okay. I don't do magic. I just say it's just science. Okay. You're 40 weeks pregnant today. Something echography and test show the baby is fine. Your cervix is still very tight. No sign of labor. Do I think induction is safe? Yes, my sister. You're 40 weeks already. We've tried to examine you to do cervical sweep to get you into labor. Your cervix is closed. Bishop's curve is 0. That's what we call the cervix. We can't get you into labor. You need to have an induction date, and you should keep a close eye on your baby movements. If you spot any change in your baby movement, just call the hospital without hesitation. So today, tomorrow morning, go and get a date for induction. Okay, that must be done before 10 days, counting 1 from your due date. See, you must be induced within the span of 10 days past your due date. Don't get to day 11 past due date for you to get induced. Get induced as soon as possible. And if you notice any change in your baby movement, call the hospital. The only sure sign of baby being okay is baby movement. And no person can know a baby's movement more than the woman that is pregnant herself. So keep a close eye on the baby movement. You've got hormonal, you say, how can you fix LH hormone? Can you send me the result? Doctor, can one with fibroid and pregnancy same time have vaginal delivery? Yes. I've seen people with 2 fibroid, 9 centimeter, and they have baby vaginally. Having fibroid does not stop you from having vaginal delivery. Okay? There's a question here that says that does high UI, that is intrauterine insemination, does it have negative effect? No. It's safe, it's okay. It has no negative effect as far as it's done properly. No negative effect that I know. Okay? Doctor, you've done ovarian cyst surgery before on the left side and it's occurring again. What do you do? If you have ovarian cyst, okay, and it's less than 4 centimeters, it's not a big deal. It's not causing pain, not a big deal. We'll scan you back in 3 to 4 months' time to check the cyst again. If it's causing you pain before then, we take it out. In most cases, if your ovarian cyst is bigger than 4 centimeters, it's causing you pain, the best way to take out the cyst through surgery. Let me tell you something. Listen to me attentively now. Now, listen to me. Listen attentively. Don't let anybody sell you any snake oil. When I say snake oil, I mean all those rubbish medication. Don't let anybody sell you any idea that a particular medication can shrink ovarian cyst. Don't let anybody lie to you that a particular medication can shrink ovarian cyst. Nothing like that. If you have a cyst, it's growing bigger than 4 centimeters, it's causing pain, my sister, remove it. You having a cycle of 40 days is not normal. Go get checked out. Okay? Thank you everyone for listening today. I can't take all questions. No, I'm exhausted. You know, I'm a human being. So, but we'll be back again tomorrow. Talk about waist sourcing compatibility, and then we'll take it from there. So tomorrow we're talking about waist sourcing compatibility. Tomorrow is 21 by God's grace. Yeah, so stay tuned and get set. I'll see you soon. Thank you everyone for listening to me today, for spending your time and data to listen to me tonight. God bless you. And have a wonderful week. And Merry Christmas and Happy New Year, in advance. God bless you. See you soon. Bye-bye.